This video is about adjusting to speaking difficulties and managing some of the common symptoms of ALS. It is designed to be used in conjunction with the ALS Association's Living with ALS Manual No. 5, Adjusting to Swallowing and Speaking Difficulties, and Manual No. 3, Managing Your Symptoms and Treatment. Just as ALS can cause muscle weakness in your legs or hands, the muscles used for speaking can be affected too. You may notice weakness in your tongue, mouth, lips, or jaw. Your speech may sound slower, slurred, nasal, and/or softer depending on which muscles are affected. Weakness of the breathing muscles can reduce the volume of your voice, as it is harder to get a deep breath of air behind your words. Difficulty speaking is called dysarthria.
ALS. Midlife.
I'm on my headset. And the connection clear? Oh, okay. Alright, well, I'll call you back later. Alright, bye.
It is normal to be concerned about the changes in your speech and to look for effective ways to continue to communicate your needs and wishes. Fortunately, there are strategies and communication devices that can make your life easier and help you communicate. In this video, we will go over some hints and tips and demonstrate communication strategies and several communication systems. When you first experience difficulties with your speech, contact a speech-language pathologist. These professionals, along with assistive technology specialists, occupational therapists, and others, can assist you with strategies for speaking. They will also recommend augmentative alternative communication systems. AAC systems, otherwise known as speech-generating devices, may be of help to you now or in the future.
The device enables me to be more independent and allows me to participate in many different conversations in various environments.
I am just grateful that so many caring individuals are working so hard for those of us stricken with ALS.
ALS experts at the Certified ALSA Centers, local chapters of the ALS Association, and ALS clinics can provide the necessary assessment and suggest techniques and equipment that will help you. Expressing your needs, feelings, ideas, preferences, and opinions allows you to control and modify your environment and your life. Although ALS may limit your physical act of speaking, you can still communicate using the techniques and devices shown in this video.
Communication is extremely important when it comes to managing ALS. The ability to communicate is vital for an individual to be able to express wants and needs to their families, to caregivers, to their friends, to their community.
There are several strategies you can use to help other people understand what you say.
Speak slowly and carefully. Repeat your words if necessary. For example, are you going to the store? Going to the store. Face your listener when you are speaking. Over-exaggerate your lip and tongue movements as you speak in order to make your words sound clearer. Carefully pronounce all syllables. Microwave. A pacing board is simply a piece of paper where you have 1 and 2 on it, and what it does is it helps the patient to slow themselves down. So instead of always saying slow down, which works for about 30 seconds, I can tap by saying my phrase. So for example, are you going to the store? For individuals with ALS, we do not have any exercises that can help how well people can understand you, your speech intelligibility, but there are strategies that can help. As humans, we typically talk about 150 to 200 words per minute. Researchers have recently found that when your speech rate reduces to about 90 to 100 words per minute, your speech intelligibility will be affected.
If your speech becomes more difficult to understand, you will want to explore AAC systems to assure that you maintain your ability to communicate effectively with others. If you have not already seen a speech-language pathologist and are having difficulty with your speech, you should be referred to a professional who specializes in AAC systems. These include a speech-language pathologist, a therapist, and an assistive technology specialist. AAC is any strategy, technique, or device used to augment or supplement communication. The use of AAC does not mean that you will stop using your natural voice.
If technology is out there, then we should utilize it the best we can. And communication devices are available for an individual to use to be able to communicate basic wants and needs, medical decisions, which is extremely important. Unfortunately, when the ability to communicate is lost, people need to rely on another person to speak for them, and we would hope that would never be the case. Even if somebody has to use a letterboard or a pen and paper to communicate a thought, at least they're able to give basic wants and needs. When somebody is considering a communication device, there are many factors that have to go into the decision to use it. Basically, the first one should be, what do you want to do with the device?
No tech means no technology is needed. It includes methods such as using gestures, facial expressions, yes or no head movements, and spelling aloud to communicate your message.
Can you show me for drink? Good. And can you show me for eat? Is your first name Danny? Are you running for governor of California? Okay. What is your name? Can you spell that for me, please?
E-A-N-I.
Danny. Nice to meet you, Danny.
Notebooks and magic slates are inexpensive, lightweight, simple tools that are very effective. A small portable notebook with pictures, words, and phrases can help you express yourself. Alphabet boards are inexpensive, portable, and can be used effectively with your hands or your eyes. You can spell a word with a pointer or scan the alphabet and indicate yes or no when your communication partner points to a row or letter. You can indicate yes or no through nodding or shaking your head, looking up or down, raising your eyebrows, or any method that is consistent and reliable. Phrases such as end of word and mistake should also be included on your letterboard.
I have chosen the male voice for the link because my husband wears 2 hearing aids and can hear this male voice better.
Another category of AAC systems includes high-tech amplification systems such as the talking tracheostomy and voice amplifier.
I can still talk and so forth, which is great.
This is a voice amplification system. This system can help if you're having difficulty with reduced volume, if you're having a hard time being heard or understood by others. This system can assist you, or a system just like this.
What do you want to do with the device? Do you want to just communicate? Do you want to write a poem? Do you want to surf the net? Do you want to be able to send email? After that decision is made, you can decide what communication device would best suit your needs.
High-tech AAC systems can be divided into 2 categories: dedicated AAC systems and undedicated or computer-based AAC systems.
Dedicated communication devices, which are devices that simply have voice output.
Where's my supper?
Then there's undedicated devices, which are either PC or laptop-based, that not only have voice output, but can enable the user to get onto the internet and send emails, surf the web, and do whatever you would do normally with a computer.
Dedicated and computer-based systems use either digitized speech or synthesized speech. Digitized speech is just another way of saying recorded speech. So for instance, I need to be sectioned.
I need to be suctioned.
This dedicated system is only using recorded speech. Synthesized speech is a computer-generated voice that can be used on a dedicated device or a computer-based device.
Today is a good day.
Here are some examples of dedicated AAC communication devices.
This device is great and I go to work every day with this link.
Caregiver support is needed when using AAC systems.
Would I do that to you?
Yes. You would.
Some individuals prefer to use the undedicated systems. Here are several types of systems that are computer-based.
Well, thanks for coming today.
Thank you, Lisa.
You're very welcome. Thank you.
Have you seen my article in the New York Times?
The eye gaze system is an access method and communication device. A small camera is mounted on the computer monitor, and the user accesses an on-screen keyboard using eye movement.
How have you been? I missed you.
There are also new AAC systems that use Windows CE technology.
I use my communication device when I am tired and have difficulty speaking.
Most of the high-tech, dedicated, and computer-based AAC devices have built-in features that can enhance your speed of typing and relaying messages. These include communication device rate enhancement features, word prediction, abbreviations, and pre-programmed messages. Word prediction is a rate enhancement feature which is designed to speed up your typing or scanning rate. Word prediction continuously predicts the words you are typing. Abbreviations can be accessed through typing or scanning.
Hello, how are you?
Pre-programmed messages are stored on a communication device.
I have a headache. Can I have some medicine?
The most successful way to communicate is by using a variety of communication systems. You may choose to write without voice output or use an alphabet board when in face-to-face conversation or in a quiet environment. In this setting, your communication partner can sit next to you and read what you have written or spelled out. In a large group setting, you may choose to use a voice amplifier or a device with voice output so you can be clearly heard. Talking on the phone may be very difficult because the listener cannot read your lips or see your facial expressions. A device with voice output is recommended while connected to a phone or when used with a speakerphone. If your hands become weak and you cannot type on a standard keyboard or touchscreen, there are several mechanical aids that can assist you in accessing your AAC communication device.
This is a Keyguard. A Keyguard is something that will adapt to a regular keyboard, and that allows the user to rest their hands on the Keyguard, and they can slide their fingers across the Keyguard until they get to the letter they wish to select. Put your finger through the hole and then select that key. This is an IST switch, infrared sound touch switch. This switch is very effective for someone who has very limited finger movement, head movement, or muscle movement. You can use this switch with finger movement, and you're just breaking the infrared beam. Head movement, cheek movement, eye blink, or jaw movement.
This is a buddy button switch, and it can be pressed anywhere on the pad to activate the switch. It's one of the most simple switches, but also the most versatile. You can put the switch anywhere on the body where there's muscle movement. This is a lever switch, most often used on the foot with a downward foot motion. This is a click switch. It can be activated by pressing it this way. Most often it's activated in a grasp motion like this. This is a wobble switch. It's on a gooseneck. It can be mounted anywhere where this clamp can be placed, on the side of a wheelchair, on the side of a hospital bed. This is a Pranky Romack P switch. It requires very little activation, And when I make an activation, the green light will go on. I can place this pad anywhere on the body.
Hello. Hey, how you doing? I'm okay. Yeah, I'm on my headset. All right, bye.
This is a scanning telephone that can be activated either through pressing the receiver or pressing a switch. What it will cause the phone to do is to scan up to 20 numbers. You can answer the phone just by saying hello, and it will answer for you. Or you could answer through this, and when it recognizes 20 seconds of silence, it hangs up for you. It's a Tash Mini Relax. It's an environmental control unit that allows the individual to have full access to their television or their remote control.
If you are experiencing early symptoms of speaking difficulties, we suggest that you schedule an evaluation at an ALS center with professionals who specialize in communication evaluations. These professionals, speech-language pathologists, occupational therapists, and assistive technology specialists, can assist you with selecting and recommending communication strategies and systems that will meet your needs.
I talk often on the phone, especially to my grandchildren who think it is great to hear this voice.
When looking at communication devices, consider systems that have the capability to meet your communication needs if you lose the ability to type and use your hands.
The earlier you seek the evaluation, the more successful you will be with the equipment.
You and your caregiver may need both patience and perseverance to make your communication solutions effective for you. It is worth the effort from you both to assure that you continue to communicate. Although ALS may affect your speaking and make it hard or impossible for others to understand your speech, you can continue to communicate. You can make your opinions, wants, and needs known and participate in social, family, business, and healthcare discussions and decisions. As you have seen in this video, there are a number of techniques and devices that can help assure that you continue to be a vital participant in conversations and in all aspects of your life. Generally, the symptoms that may accompany ALS can be managed to reduce the impact on your life. This video includes discussions of a few of the common complaints. For more information on these and other bothersome symptoms, refer to the ALS Association's Living with ALS Manual No. 3 and consult your healthcare provider for the treatment that is most appropriate for you. It is not uncommon for some people to experience exaggerated laughing or crying, muscle cramps, problems with excess or thick saliva, or depression. It is important to understand that there are effective treatments for each of these symptoms. Emotional lability, or pseudobulbar affect, are terms to describe difficulty in controlling behaviors such as crying and laughing. You may cry or laugh easily, in excess, or at inappropriate times. Understandably, the symptom can be upsetting to you and your caregiver.
Dr. Mandler, at the support groups I've noticed that some patients inappropriately start laughing or crying when emotional topics are discussed, and it's very distressing to them and they don't really understand what's going on. Could you explain a little bit about that?
Well, the first thing we explain to the patients when we talk to the patients and the families that those reactions are part of the disease. They are part of the syndrome.
You were telling me at the time that you were feeling happy, not depressed, and yet you were crying. And it seemed as though the emotions were just breaking through on you and you didn't want them to.
Although the exact cause of pseudobulbar affect remains unknown, many medical experts believe that it is related to lesions or injuries in certain pathways of the brain that normally allow us to control emotional expression. Because the lesions interfere with how the brain handles information, the outward expression of the emotion becomes disconnected from the emotion that the person is actually feeling. The ALS practice parameter provides recommendations for managing symptoms, including pseudobulbar affect and excessive saliva.
My conviction that what we are doing is treating the quality of life of patients. Patients don't often volunteer that. Caregivers don't even volunteer that. But if you bring it up, they'll say, oh my goodness, I didn't even know that was part of the disease. You mean when she starts to cry in public that this is not just that she's being depressed, this might be part of the disease. And I think if you can validate that for the patient, validate for that for the family, they'll be very accepting, again, of some attempts to try to make that better for them.
Along with being emotionally disconcerting, the affect interferes with speech, interferes with breathing, interferes with the ability to chew and to eat. And really, when you relieve the symptom, you make life easier for the patient and function greater.
Discuss various treatment medications with your healthcare professional.
You can certainly make a huge difference in that, again, social context, quality of life type of issue. So the major approaches have been used tricyclic antidepressants, so-called. In fact, Elavil is a very good one. Some people like using nortriptyline or Pamelor. The other side of that is the newer agents, the SSRIs, or selective serotonin reuptake inhibitors, of which everybody knows about Prozac. And it's not to say that this is some psychiatric problem. It's really trying to solve the facial manifestations that are so disconcerting to the people around them. And in fact, the caregiver often has more problems with it than the patient.
A promising new treatment, Neurodex, is in clinical trials. Evidence from early studies shows that Neurodex decreased the severity and frequency of pseudobulbar episodes and improved the quality of life. Although pseudobulbar affect is not physically harmful, it can have significant negative effects on quality of life and relationships with others. The frequency and intensity of pseudobulbar affect episodes can vary from person to person, and many people experience frustration with the inability to control the expression of their emotions.
Does anybody have cramping with ALS? I've had it, and I asked Dr. Bradley for a recommendation on medications. I've heard the name baclofen passed around on some of my email groups on the internet, and I also heard that quinine does a remarkable job.
Muscle cramps are contractions of one or more weakened muscles due to a sudden overactivity of motor nerves. Cramps can be mild and intermittent or be prolonged and cause severe pain. Muscle stretching exercises and staying well hydrated can help reduce the frequency of muscle cramps. There are also medications and other compounds that can be effective. These include quinine sulfate, baclofen, clonazepam, and gabapentin.
We ended up looking just at the problems of excess salivation leading to drooling and figured out that, in fact, it really probably isn't excess salivation as much as they just can't handle the saliva that they produce. And it begins with getting excess salivation at night. Their pillow will be wet at night, and sometimes it goes on, and probably in about a quarter of the patients, it leads to some drooling during the daytime. Very socially disconcerting. And it's something that I think all of us try to approach because it is something we feel like we can do something about.
Drooling and excessive saliva can be treated very effectively. There are a couple of different medications that will dry up the saliva and make it less thick and ropey and make the problem very much less frustrating.
Now, we have a number of ways to help you. In addition to take your tissue, we might have some medications and also some devices. So we have a suction device that some patients use, which is a small portable device. Have you used it already?
Yes, but very noisy.
Noisy? I see, I see. So we have a number of medications to try. knowing you, knowing that you don't have any problems with changes in mood, and you are very well involved at work, and you want to be very awake, we probably won't use Elavil in your case. And we might use Altropin, we can use Robitussin, we can use Robinul, we can use sometimes a patch, which is a scopolamine patch that you can put on the skin, and it lasts 3 days.
Botulinum toxin injections have been used for treatment of excessive saliva. Research studies are in process to evaluate the effectiveness and safety for people with ALS. Feelings of sadness, loss of interest in daily events, irritability, anger, sleep disturbances, and reduced appetite can occur and may indicate that you are understandably depressed. You can get relief from these symptoms through a number of available treatments. Medications can help you feel more like yourself and less angry or helpless. Although the speaking problems and symptoms described in this video are challenges, there are several ways to maintain your communication and successfully manage the symptoms. By planning ahead and using the techniques and equipment presented in this video, you can improve the quality of your life.
In my mind, I made sure I didn't need money.
The ALS Association offers several free educational materials on speaking problems and treating symptoms that ALS can cause. Just contact us for more information and help in adjusting to problems with speaking and symptom management. You are not alone in your fight against ALS.
The ALS Association gave me a lot of advice and help, and the computer is a big help.
The ALS Association thanks the people with ALS, their families and healthcare providers who were the inspiration for this video and who welcomed us into their homes and their lives. This video and others in the ALS Association's Living with ALS series is provided without charge to patients and families thanks to the generosity of our individual donors.